Welcome back to CVM at Sunrise. In many ways, mental health is just like physical health. Everybody has to, and we need to take care of it. Studies have shown that more than 300 million people suffer from mental disorders globally. Among the most common of these are depression, anxiety, and substance use disorders, and these affect persons of all walks of life. Now, this morning, we are joined by Dr. Benedetto Saraceno, Secretary General of the Lisbon Institute of Global Mental Health and Professor at Global Health at the University Nova of Lisbon, Portugal. And Dr. Saraceno is in Jamaica for meetings to discuss mental health issues and assisting Jamaica going forward. And we welcome both gentlemen. Oh, we also are joined by Dr. Wright as well. So we want to welcome both gentlemen as we have a serious discussion on the topic of mental health.
Absolutely, and Dr. Wright is here this morning. He is the president of the Jamaica Psychiatric Association and chairman of the National Task Force on Mental Health and Homelessness. So we're very happy to have two gentlemen who seem to have dedicated their lives and their careers to the cause of mental health. Good morning.
Good morning. Good morning.
So let's start with you, Dr. Wright.
Yes.
In terms of being head of this task force, give us some context as to why one needed to be formed in the first place. What was happening in Jamaica that saw a need to really examine this area?
Well, the task force was formed by the Honorable Minister of Health, Christopher Tufton, to really focus on the mental health problem that we have in Jamaica. We have been on a long road to developing mental health, and many times mental health is not given the importance that it should. Mental health is the most common non-communicable disorder.
Globally or for Jamaica?
For Jamaica and for the world in general. Depression is the most common illness. Approximately 10 to 15% of individuals will have depression, and it goes up to 20 to 30% here in Jamaica of people with diabetes, high blood pressure, etc. And then we have the substance abuse disorders. In Jamaica, alcohol is a major problem.
Definitely.
Marijuana abuse is another problem. So we have the substance abuse problem, the anxiety problems. In Jamaica, we have a lot of stressors, and therefore individuals will react to this stress with anxiety disorders and depression, and that increases the number of people with mental health problems. I always say that everyone, bar none, will have a mental health problem sometime in their life.
Everyone?
Everyone, bar none. And I'm not talking about someone being psychotic or ill. Just like how you have a cut or you get the flu sometime in your life, when you're not feeling well, when you have you're going to take an exam, when your mother has died, your family member died, and you're not feeling well, at that time you have a mental health problem. It's not a mental disorder. You don't need to go to the doctor to be treated for it. But it's the brain that is under stress and is shifting and not working, not dealing with problems as well as they should.
It could or it should.
There's one thing that you mentioned, Dr. Wright, and it's anxiety. You said Jamaicans experience a lot of stressors, and anxiety is one of the disorders that arise as a result. What exactly is anxiety as a mental health disorder?
When you start having your heart beating fast for no reason, you can't breathe, you're feeling out of sort, your blood pressure might go up, or you become more irritable, etc. These are all symptoms of anxiety. You feel out of touch. Your comfort zone has shifted.
Some of the recommendations that you made were that your task force made was to establish more green spaces, for example. Why is that necessary for persons with mental disorders?
Well, one of the things about stress, is that stress needs to be managed. Just as you said earlier, that like a physical illness, you need to take care of it when you're under severe stress. And everybody going to be under severe stress at some time in their life. You need to step back. You need to take a break from the stress. You need to get some social support, talk about the problem. One of the things I always say, that any problem that a person has, you should talk to somebody about it. Not only to solve the problem, but to get it off your chest.
Just to vent, let it
Just
go,
to vent.
release.
The research shows that those people that talk a lot live longer than those that don't talk at all. If you keep things on your chest, you're bottling up, and releasing things is good. Exercise.
It's very important.
Exercise is very important to manage it. So the green spaces, if you have a green space that you can go to, be near to nature, exercise, do relaxation, meditation, yoga, those sort of things, then it decreases the stress level and help you to get back to your normal self.
Dr. Saraceno, to bring you in here, what were some of the issues taking place in, for example, in Portugal, and how did you guys start to address that?
Or in general, Europe in the last 20, 30 years, with different speed between countries, went through a radical shift from a hospital-based model to a community-based model. The decline of the number of beds in psychiatric hospital, and even the closure of majority of psychiatric hospital, is a European phenomenon in general. Okay. So now the focus of the mental health systems is community, and if you need beds for an acute case, those beds will be in general hospital and not in a special, isolated, separate hospital. So in a way, Europe has declared the traditional psychiatric hospital dead.
And that's an interesting thing to note, and something to be celebrated, because Europe has had a long history of locking away persons for hysteria, for women who dare to oppose their husbands in many years ago.
An illness if she's speaking out this way.
Were sometimes sent away as some form of informal social divorce, and they were locked away in psychiatric institutions with very strange maladies being assigned to their condition, when perhaps they were just having a brief moment of stress, or were just saying what they thought about a situation that general society probably didn't agree. To do away with that model and incorporate psychiatric care as part of a community approach is interesting to note. How have you translated that change now into your support for Jamaica's task force, for our efforts to advance our mental health here?
But the feeling I have coming here and knowing Professor Wright is that we are exactly on the same way of thinking. And if you look at the recommendation of a task force, they are not just the recommendation of a group of visionary, mad people. These recommendations are reflecting the direction and the guidelines of the World Health Organization, of the Pan American Health Organization, of the modern evidence-based science. So the model that the task force is recommending, this increasing the mental health literacy in primary care doctors, shifting from the hospital to the community, reducing the hegemonic role of Bellevue, are recommendations that are perfectly online with the international guidelines from the United Nations agencies.
Mental health, or treating mental health disorders, is seen as being expensive by a lot of persons. How can we get that shifted? Like, how can we get it into primary health care, or to make it just less expensive?
Well, let's look at it. And we're talking about one specific disorder now, the most severe mental disorder, schizophrenia. Previously, what happened is that people with schizophrenia were taken from all over the island on train before, and buses, and taken to the mental hospital. And in the 1970s, the mental hospital had approximately 3,500 patients. we have developed the community mental health service in Jamaica, that we have geographical areas, each divided into regions. So you have the western region, northeast, southern region, and southeast. And within that region, we have psychiatric teams that consist of psychiatrists, mental health officers, psychiatric aides, nurses, and community health aides also that go out and treat the patients both at the health centers and in the hospital. We have approximately 800 patients at Bellevue now, and approximately 500 of those patients are discharged, but they're nowhere for them to go to the community because they have been disconnected from their families for many years. That is what we're trying to stop. We're trying to stop institutionalization. So at the present time, we treat more patients in the general hospital setting, in the Cornwall Regional, Lucy, Mandeville Hospital, St. Anne's, etc.
KPH
or
well?
KPH also. All general hospital accept and treat patients with mental disorders and discharge them back to the community services where they are followed up. The importance is that after they are treated, the acute phase is treated, the hospitalization phase is treated, they return to the community. The support systems have to be there. In other words, those patients need to ensure that they get their medication on a daily basis. And sometimes the patients get long-acting injections, so they don't have to take the medication daily, or it's an addition to. And so, but the treatment is very important, and the support services, that the mental health team is available to support. When they go to the clinic, they get a range of services, and the patients are followed up to make sure that they continue in treatment. If they drop out, the mental health team will go to visit.
Home visits?
Home visits at time. If we don't see them at the clinic, when the mental health team goes out, there's a register that we follow to see who has dropped out. In addition to that, if there's an emergency, because emergencies do happen, the mental health team is available to respond to these emergencies.
That's very interesting. On this Women's World Thursday, there's a particular mental health condition that I want to ask about, and it's postnatal depression.
Postnatal.
And
Postpartum
depression. Postnatal. That's all our lives. Postpartum depression and other conditions arising in women following the birth of their children. How is that viewed in our local health services, and are there provisions available for young mothers or for women who have just had children who just might not be feeling right and who might not be feeling the way they thought they should feel after giving birth to their child? What are the systems, and how can they get help?
Okay. Postpartum depression is a common mental disorder. In Jamaica, as in most countries, women suffer more from depression than men. And the reason for that is not that the men give them more problem. The reason for that is a hormonal problem. Right?
Oh my goodness.
Right? So, and women tend to have increased depressive problems during the perinatal, after delivery and at menopause. So we look out for depression at that time.
Right.
At the Victoria Jubilee, we have a screening instrument that we screen patients for depression so that we are able to pick up those patients who are having postpartum depression.
Or maybe prone to experience those.
And also, many women, a significant percentage of women will have what we call postpartum blues. They get sad during this period because of the hormonal fluctuation, but that's usually settled. But a percentage, approximately 15% might go on to...
But what if a woman feels that way? So she's probably at home and she hasn't identified it as postpartum depression, but she doesn't feel the way she thought she would feel. Can she go to one of those hospitals you identified across the
You don't
region?
need to go to the hospital. One of the things I always ensure that every doctor is trained to pick up symptoms of depression. So the general practitioner is the first stop.
Okay.
And the general practitioner is qualified and able to recognize and treat postpartum depression effectively. If the patient becomes suicidal, etc., then you move to the other level of care.
Well, we are almost out of time.
Yes, and so much more to discuss.
So much more to discuss. And Dr. Saraceno, Professor Saraceno, we are so happy about the insights that you'll be able to share with our team here in Jamaica. And we really look forward to making inroads into this area of social health, of public order.
Removing the stigma.
Removing the stigma, and to understand that everyone may have a mental disorder, will have, Dr. Wright said, a mental, oh my
Mental
goodness,
problem.
a mental problem, a mental problem. And
One family out of 4
Wow.
in the
You
world
fall in
has
love.
a mental health problem.
Wow, you fall
this
in
room,
love, you
there
fall
are 8 people, at least 2 people in this room have a mental health problem
Wow.
in their own family.
Wow. Well, that's all the time we have right now. We are up on a break. Stay with us. We'll be right back on CFM at Sunrise. Thank you.